नमस्ते बिटिया, हमेशा खुश रहो बिटिया। I am Dr. Bharat Sharma, Assistant Professor, Department of Pathology, Faculty of Homeopathic Science, JAYOTI VIDYAPEETH, Women's University, Jaipur. Today's topic is acute inflammation, vascular events. Acute inflammatory response by the host to any agent is a continuous process, but for the purpose of discussion, it can be divided into following two events. First is vascular events and second is cellular events. Vascular events. Alteration in the microvasculature, arterioles, capillaries, and venules is the earliest response to tissue injury. These alterations include hemodynamic changes and changes in a vascular permeability. Now, hemodynamic changes. The earliest feature of inflammatory response result from the change in the vascular flow and caliber of small blood vessels in the injured tissue. The sequence of these changes is as under. First is irrespective of the type of cell injury, immediate vascular response is of transient vasoconstriction of arterioles. Next follows persistent progressive vasodilation, which involves mainly the arterioles but to a lesser extent affect other component of the microcirculation like venules and capillaries. Next is progressive vasodilation in turn may elevate the local hydrostatic pressure, resulting in transudation of fluid into the extracellular space. Slowing or stasis of microcirculation follows, which cause increased concentration of red cells and thus raised blood viscosity. Stasis or slowing is followed by leukocytic margination or peripheral orientation of leukocyte, mainly neutrophils, along the vascular endothelium. Triple response. The feature of hemodynamic change in inflammations are best demonstrated by the Lewis experiment. Lewis induced the changes in the skin of inner aspect of forearm by firm stroking with a blunt point. The reaction so elicited is known as triple response or red line response, consisting of the following. First is red line appears within a few seconds after stroking and is due to local vasodilation of capillaries and venules. Second is flare, is the bright reddish appearance or flush surrounded the red line and result from vasodilation of the adjacent arterioles. Wheal is the swelling or edema of the surrounding skin occurring due to transudation of fluid into the extravascular space. Now, second is altered vascular permeability. In, in and around the inflamed tissue, there is accumulation of edema fluid in the interstitial compartment, which comes from blood plasma by its escape through the endothelial wall of peripheral vascular bed. In the initial stage, the escape of fluid is due to vasodilation and consequent elevation in hydrostatic pressure. This is transudate in nature, but subsequently the characteristic inflammatory edema exudate appears by increased vascular permeability of microcirculation. The appearance of inflammatory edema due to increased vascular permeability of microvasculature bed is explained on the basis of Starling hypothesis. According to this, normally the fluid balance is maintained by two opposing set of forces. First is force that cause outward movement of fluid from microcirculation. These are intravascular hydrostatic pressure and colloidal osmotic pressure of interstitial fluid. Second is force that causes inward movement of interstitial fluid into circulation. These are intravascular colloid osmotic pressure and hydrostatic pressure of interstitial fluid. Whatever little fluid is left in the interstitial compartment is drained away by lymphatics, and thus no edema result in normal condition. However, in inflamed tissue, the endothelial lining of microvasculature becomes more leaky. Consequently, intravascular colloid osmotic pressure decreases and osmotic pressure of the interstitial fluid increases, resulting in excessive outward flow of fluid into the interstitial compartment, which is exudative inflammatory edema. Patterns of increased vascular permeability. Increased vascular permeability in acute inflammation, by which normally non-permeable endothelial layer of microvasculature become leaky, can have following pattern and mechanisms, which may be acting singly or more often in combination. First is contraction of endothelial cell. An example of such immediate transient response in mild thermal injury of skin of forearm. Contraction or mild endothelial damage, classical example of delayed and prolonged leakage in is appearance of sunburn mediated by ultraviolet radiation. Third is direct injury to the endothelial cell. The examples of immediate sustained leakage are severe bacterial infections, while delayed prolonged leakage may occur following moderate thermal injury and radiation injury. Fourth is leukocyte mediated endothelial injury. The examples are seen in sites where leukocytes adhere to the vascular endothelium, that is, in pulmonary venules and capillaries. Leakiness in neovascularization. In addition, the newly formed capillaries under the influence of vascular endothelial growth factor during the process of repair and in tumors are excessively leaky. This session is powered by Digital Version 2.0, Jyoti Vidyapeeth Women's University. I hope you all enjoy this session. If you have any query, please mention it in comment box. Thank you.